Shingles? It's a word most of us have heard, and it probably makes you wince just a little bit. But what is it really? Where does it come from? Well, today we're going to pull back the curtain on this virus that, for many people, is just waiting. And as you'll see, its comeback tour can be absolutely devastating.
To really get a handle on shingles, you have to start with the pain. Just listen to this quote from a 63-year-old harpist. I mean, think about that. Someone whose entire life and passion is playing music, and this pain made it impossible. This tells you right away we're not just talking about a simple rash. This is something that can completely alter your life.
And here's the kicker. This is not some rare one-in-a-million disease. No, the data shows that 1 in 3 adults will get shingles in their lifetime. 1 in 3. Just think about the people you know, your family, your friends. The odds are one of them is going to deal with this. So this isn't just some abstract medical topic. For almost all of us, this is personal.
So what is this thing? This virus that causes so much trouble for so many people? Well, the answer is probably already inside of you right now.
Okay, so the official medical name is herpes-zoster. And here's the most important thing to understand. Shingles is not a new infection that you catch from someone. It's actually the second act of a virus you almost definitely met when you were a kid, the varicella-zoster virus. You probably know it by its more famous name, chickenpox.
Right. So after you got over the chickenpox, the virus didn't just pack its bags and leave your body. Oh no, it retreated. It went deep into hiding inside your nerve ganglia, which are these little clusters of nerve cells. And there it sits, totally silent, dormant, sometimes for decades, just waiting for its chance to come back.
So what wakes this sleeping dragon up? Well, it's pretty much anything that weakens your immune system's security detail. The #1 risk factor, by far, is just getting older. Our immune systems just aren't as tough as they used to be. But other things can definitely tip the scales too. Things like cancer treatments, certain chronic diseases, or even just a period of really intense physical or emotional stress. So when the virus does wake up and make its move, it actually follows a surprisingly predictable script. Let's walk through what a typical shingles outbreak looks like.
Now, the really fascinating part here is that first phase. Before you even see a single spot, people often feel this weird, localized pain. It can be a burning or a tingling or even shooting pains. That's the virus literally reactivating and traveling down a nerve path to your skin. It's only after that pain starts that the classic shingles rash shows up, almost always in a single stripe on just one side of your body. From there, it blisters, scabs over, and heals, a process that usually takes about 3 to 5 weeks.
For most people, once those scabs fall off, the story's over. But for some, that's when the real nightmare begins. The end of the rash is just the start of a much longer and way more painful chapter.
The most common and, frankly, most feared complication is a condition called post-herpetic neuralgia, or PHN. And as you can see, this is not some super rare outcome. We're talking somewhere between 10 to almost 20% of people who get shingles end up with it.
So what is PHN? It's basically the ghost of the rash. The virus, as it rampaged down your nerve, caused real physical damage. And the result is this awful nerve pain that can last for months or even years. And the risk of this happening goes way up the older you are.
But there's another major complication we have to talk about. This one isn't just bad, it's a true drop everything and go to the ER emergency. And that's when shingles shows up on the face, especially anywhere near the eye.
This is called herpes-zoster ophthalmicus, and it can happen in up to a quarter of all shingles cases. The virus reactivates in the nerve that supplies your face and, crucially, your eye. This can cause all sorts of horrible problems, even permanent vision loss. There's a really key warning sign here that doctors look for. It's called the Hutchinson sign. If you get blisters on the very tip of your nose, that's a huge red flag, because the same nerve branch that goes to the tip of your nose also goes to your cornea. It's a direct warning that your eye is in danger.
Okay, so after all that scary news, what can we actually do about this? Well, the good news is we have very effective treatments. The catch? The clock starts ticking the second that rash appears. 72 hours. If there's one number you remember from this entire explainer, please make it this one. To have the best chance of working, antiviral medication has to be started within 72 hours, that's 3 days, of the rash first showing up. Acting fast is absolutely everything. When you start those antivirals within that 3-day window, you stop the virus from making more copies of itself. This helps the rash heal faster and be less severe. But here's the most important part. It dramatically lowers your risk of developing that awful long-term nerve pain we just talked about. So what will a doctor give you? There are three main options. Acyclovir was the first one, but the newer ones, valacyclovir and famciclovir, are often used now because you don't have to take them as many times a day, which just makes it easier for people to stick with the full course of treatment.
But as great as these treatments are, they aren't our best weapon. You know, the best way to fight shingles is to make sure you never have to fight it at all.
And for that, we have an incredible tool. The modern shingles vaccine, called Shingrix, is more than 90% effective at preventing shingles in the first place. I mean, that is just a home run. That is a fantastic level of protection.
So who should get it? The CDC's guidelines are really straightforward. If you're age 50 or older, you should get the vaccine. It's 2 shots, a few months apart. And listen, even if you've already had shingles once before, you should still get vaccinated to help prevent it from coming back. It's also recommended for anyone who got the older, much less effective vaccine years ago. This is, without a doubt, your best shield.
Which really brings us back to one final thought. You fought chickenpox when you were a kid, and you won. But the virus never surrendered. It just retreated. It's still there, waiting. So the real question now is, are you going to do what it takes to make sure it never gets the chance to launch a second, much more painful attack?